Hello, welcome to another episode. Thanks for hanging out with me again today. And today I'm talking about, of course, self-disclosure in the context of being a healthcare provider, mental health care provider. So for context, in my day job, I am a licensed naturopathic doctor. I specialize in mental health, and I work alongside about 18 counselors and therapists. Our company works with a very varied population, from kids through adults, individuals, couples, all that kind of stuff. I only work with adults, and I see primarily anxiety, depression, bipolar disorder, ADHD, and autism. And in the scheme of my career, I'm still pretty early on. I opened my practice initially in 2019, and so I'm really only, 5 years into this. And so if we're talking about like careers that are 20, 30 years long, very early on, my opinions may change at some point, of course. And obviously, this is all sort of my opinion based on conversations I've had with colleagues and friends, and also doing some additional reading and research about what sort of the field's perspective is in terms of disclosure and self-disclosure in this context. And what's most important to start with, I think, is the fact that relationship is crucial in the context of medicine in general, but also within mental health. Relationships of any kind are super important to us as humans. We need to be connected to other people. And in the context of, family life or friendships and personal life, there has to be a give and take. Both parties are sharing various kinds of amounts of information, and part of this formula of like friendship or closer relationship has to do with kind of frequency and intensity of interactions. And intensity of interactions can be related to how much information are parties sharing and disclosing with one another. Obviously, if I'm telling somebody my deepest, darkest secrets, I'm probably have a closer relationship with them than I do with somebody with whom I'm only going to be talking about, oh yeah, the weather and how was your vacation? Oh, it was great. Yeah, thanks. Like, these are very different kinds of relationships. And so in the context of mental health treatment and healthcare, this matters because providers are human, just like our patients and clients are human. And as an aside, I'll probably use the word patient because that's how I refer to my folks who I work with, but either certainly applies. At any rate, but in mental health, when somebody's choosing a therapist or a provider, that relationship between the patient or client and their provider really makes a huge difference. And being able to connect with someone, or an inability to connect with someone in this very unique context, can make the difference between being able to make progress in healing and this sort of thing and not being able to do that necessarily. And so it's really worth thinking about and considering what is appropriate to self-disclose, having both of these things in mind. The other thing to keep in mind, and kind of laying the groundwork for this conversation, is that this idea of transference. And so in psychology and in mental health care for a long time, there's this idea that you shouldn't tell your patients or clients anything about yourself. You need to be a blank slate. You need to be totally clear of any sort of interfering information, because transference happens where patients or clients will transfer their feelings about somebody else in their life, something else that's going on in their lives, onto you. And in that blank space that you provide, what then happens is that clients can fill in the gaps with their own biases and thoughts and feelings. And through this, you're able to then help support the generation of insights, which then leads to healing. And it's not that simple, but there you go. I do have a number of resources that I will have listed in the description or show notes. I don't know what we call it on YouTube. I'm still new to YouTube. But at any rate, there's a really nice article that Psychology Today put together about transference if you want to dive into that a little bit more. Of course, there's countertransference that goes along with that, which is what the provider, feelings that they have about the client or patient, etc. So at any rate, it's worth being aware of that, and that this ability of patients to have this experience also informs what we think is or isn't appropriate to share or disclose about ourselves. Like I said, I don't do therapy with folks. My role is really more focused on medication management and that more physical aspect of mental health. So, diet, exercise, sleep, and really supporting the body as a component of the whole person. And sort of where I fit in here, one of the counselors described it really beautifully. They said, what you're doing with medication with this person gives us more room to work and do our work together. And so ideally, that's how it goes, where you have somebody who can do kind of the medication management physical piece of things with people, and then somebody else who's really diving into the, psycho-emotional piece of things with people. And so over the years throughout my training, I have been told any number of different things about self-disclosure. I have been told never disclose anyone, like this blank slate kind of a thing, like people don't need to know about you, they don't care about you, it doesn't matter, which doesn't super jive with my experience, but that's okay. I've also been told, you're human, they're human, so share whatever you want. And this bleeds into social media. Like, you can put whatever on social media, it's fine, this and that, which I also don't agree with for different reasons. I don't think that's appropriate. And then there's a middle ground here, which I have been told and which I agree with the most, which is sometimes it is okay to disclose. And what I have been told, there's more nuance here, which we'll get into, but what I have always been told is it's only okay to disclose information if the subject matter is not emotionally charged for you. And we'll talk more about why that is. So by way of example, in terms of like public examples of self-disclosure, and you can find I'm sure there are a bunch of folks on different social media platforms who are self-disclosing any number of different things, but I think there are a few examples that are super interesting in this conversation. One is that there's a regular feature in JAMA, which is the Journal of the American Medical Association, and it's an editorial feature. It's called A Piece of My Mind. And again, I'll link all of this in the description. But in this particular feature, a variety of different kinds of medical doctors and specialists will describe their own experiences. Typically, what will happen is that, or the ones that I've seen, are that, somebody has their own health issue that falls into what their specialty is. So one I read recently was an OBGYN who was describing her experience deciding whether or not she thought that she was going to need to have an abortion. She had wanted to become pregnant for, however long, and finally did. And then a question was raised in terms of the testing of whether or not that pregnancy was viable. And so heartbreakingly, like, she was faced with this really difficult decision of what to do with that information. And so having performed this procedure, however many hundreds, thousands of times before, she walks through how different that is being on the other side of the clinic room. And it tends to be an interesting feature, and I enjoy reading it for a variety of reasons. And so this is a very public, right? This is published in a medical journal, a very public self-disclosure that the authors of this editorial will make, and it rotates. It's different folks who will go through there. There's also pretty well known in mental health, pretty well known, I guess, is the self-disclosure of Martha Linen. And I don't know if I'm saying her name right. It might be Linehan. At any rate, this is the woman who developed dialectical behavior therapy, also known as DBT. And DBT was developed as really the first effective therapeutic approach for folks who have borderline personality disorder. This is a very difficult condition to have. It's a very difficult condition to work with therapeutically. And so DBT coming on the scene was like, whoa, this works. It's super helpful. This is great. It just so happens that, as an aside, it also happens to be helpful for a number of other things as well, and is incorporated into many different therapeutic plans. But Martha Linehan disclosed publicly that she has had borderline personality disorder. And so she had it to the point that she ended up being hospitalized. She engaged in some very difficult and problematic behaviors, self-harm behaviors, this sort of thing. And through this kind of work has been able to come through to the other side of it, and really has been able to live her life in a way that is good for her and has been good for her. And so that is also very public and relatively well-known example of self-disclosure. There's also the example of Kay Redfield Jamison, who's a PhD, and she researched bipolar disorder and was very well known for her work with bipolar disorder, to my knowledge. And she self-disclosed that she also had bipolar disorder and has written fairly extensively about her experience with living with that. And so that's another example of someone who is kind of in the weeds doing the work, hands in the dirt, so to speak, with this, and also has a very close personal experience with that particular disorder, self-disclosing, hey, yeah, like this is a thing. I'm working through it too, and learning more about it is helpful for me as well, and hopefully my experience and my research can be of help to others. So all of that said, right, there are some, you can see how in those examples of Jameson and Linehan, that them disclosing could lend a lot of credence to the work that they did. Of course, there's also the objective benefits of those things, and sort of now there's a bunch of clinical information about how effective DBT is and all of this, but you can start to see a little bit of what those benefits are of self-disclosing. I really like, there's a paper I found called Should Psychiatrists Self-Disclose, where the author walks through, he brings up those two folks, and also walks through the pros and cons of self-disclosing or not self-disclosing. And it was pretty nice to read because I was like, oh, it's an older paper, but it pretty much lines up with my own experience and my thoughts about the whole thing. So that was sort of nice validation for me. But it is worth thinking about, and it's worth thinking about when you're not in the room with somebody, so that when you are in the room with somebody, you have a framework to say, oh, yes or no, I should just keep my mouth shut and kind of sit back here, or, this is a moment where I think sharing this bit of information would be super helpful, so let me go ahead and do that. And so some benefits that he shares are instilling hope for patients and reducing shame, and improving confidence in the provider. And I have seen, when done properly and when done at the right time, place, manner, all of that, that these things do really pan out. Personally, I tend to not self-disclose a whole heck of a lot here and there. I may say, oh yeah, I saw that movie or whatever. And there are some inevitable disclosures that are made just by virtue of, like I wear a wedding ring, and I don't have any pictures of my family in my office, but I do have like my dog on a mug. And so folks might see that or whatever, like, oh yeah, you want to check out my dog, whatever. And so that sort of is very surface level, which is maybe a different thing. Maybe it's not. But when it comes to this issue of sort of instilling hope and reducing shame for patients, where I see it most happen in my own practice is when I do work with folks who are autistic. I do autism assessments for adults. And so these are folks who have gone 20, 30, 40, even 50 years with a sense of, I don't fit in, I don't know why, I can't figure out why I can't get my relationships to work, why I can't seem to make it work at work, excuse me. I don't seem to fit in with any particular friend groups. Like, what the heck is wrong with me? And so we'll go through this process of the assessment and get to the other end of it. And if it's a positive diagnosis, a lot of times folks will sit back and be understandably fairly upset. There can be grief that comes along with this, some difficulty in kind of reconciling, like, how did no one see this before? Like, what the heck was going on? I could have had all the support. Totally normal experience for folks to have. There can also be a feeling of shame of, why couldn't I figure this out before? Why couldn't I make this work before now? And so this is all makes a lot of sense and is totally relevant. And so what I will sometimes do if somebody's really struggling with this, because I am a licensed doctor and I am providing care for them, I'll say, hey, just so you know, like, everything you're experiencing is totally valid and makes a lot of sense to me. And I have been there because I also am autistic. And so with that information, folks will often sort of sit back and be like, oh, really? And so they may ask some additional questions about, well, how did you get through this? Or how did you figure out that, or whatever. Sometimes they don't ask anything else and they're like, oh my gosh, that's so helpful to know. Because it provides an example for them of the fact that that diagnosis does not have to be limiting necessarily, that there are ways to work around it and with it, and that there are any number of life paths that are available to them. I have also had conversations with folks who are afraid because of this diagnosis, they're never going to be able to find like a life partner or a spouse or something like this. And so I made self-disclose, like, oh yeah, totally, I get that, here's my experience with all of that. So that's where I will typically self-disclose with folks, is in that arena specifically. And I have seen it reduce the shame. I have seen it give folks hope. And so for me, it's worth it to have that conversation. It can also be super beneficial for, and this comes from the Psychiatric Times is where I saw this, but it makes a lot of sense and have talked about it with colleagues, is modeling different behaviors for patients. I think in the best case, in ideal worlds, a medical provider is able to model healthy relationships, particularly in mental health. Mental health providers should be able to model healthy relationships. And that includes, boundary setting, timekeeping, keeping conversations on track, all of this sort of thing. Compassion, in an appropriate way, whatnot, professionalism, etc. But it also includes being able to say, oh yeah, like I've been there, this is how I felt at that time, and being able to model what that looks like after the fact, of being able to share emotions in a really honest and frank way, without there being necessarily like that charge attached to it, or like a heatedness to it, or explosiveness or any of that. Like, oh yeah, I would feel super angry too, or like something similar happened to me, I was incredibly angry. That makes total sense that you would feel that way. So that sort of modeling. And also, of course, I really love this phrasing, being there for a moment of humanity, which is what it's all about, really, at the end of the day. Obviously, as providers, mental health providers, there are skills and tools that we use with our patients and clients. But at the end of the day, I'm a person talking to another person. Patients come in, they're just humans, And so there are moments of just, yeah, that is super hard. And I've been there too. And I know how hard that is. That is that sharing of humanity. There are also a lot of really good reasons to not self-disclose and to keep your mouth shut and let it go. And so, of course, obviously, this shouldn't need to be said, but anything that would be a potentially an ethical violation, like, yeah, shut up about it. Don't say anything. Don't do anything. You need to like get your head right and move on. And so there are, of course, some different particulars and details of ethical guidelines depending on the field. So like the APA, American Psychiatric Association, or Psychological Association, puts out ethical guidelines. My professional association, the American Association of Naturopathic Physicians and the Oregon Board of Naturopathic Physicians, puts out ethical guidelines. And so, obviously wherever you fall in this, you would follow your particular profession's guidelines, and of course your own integrity. And also, like I said, I'll link this in the description, but the Psychiatric Times, they put an article together about the ethical aspects of self-disclosure, which I thought was really lovely. They have a really beautiful table in there, and they talk about considerations like respecting the dignity and autonomy of patients, not being manipulative, making sure that you're maintaining a really clean, ethical, financial relationship with folks, and of course always, speaking and acting to the benefit of patients and clients and not harming them, which again shouldn't need to be said, but just so that that's clear. A time when it is not appropriate to self-disclose is if you're disclosing for your own benefit and not to the benefit of the patient. We're all humans, like I said, as sort of the mantra of this video. We're all human. It's natural. Like, you want to share with folks. You want to build, because because work with patients and clients is based on the relationship, it's very natural to do the things that you would do in other contexts, in terms of like, oh yeah, like I love this about this, or I love that about that, or yeah, I super vibe with XYZ. And so it's very normal, but there are times when that's absolutely inappropriate. And if it's more because as a provider, somebody is wanting to vent about something or complain about something that's going on in their own lives, or whatever it is, like, this is a problem and is wildly inappropriate. It can altogether shut down the therapeutic relationship, because now the patient knows too much about you. The patient knows too much about their provider, and they will then moderate what they feel like they can or can't say based on that information. If somebody is coming in and they're having trouble parenting young kids, and then the provider's like, oh yeah, like, let me tell you what's going on at my house. It's not great. This is not good. Because the provider is still in it. They haven't resolved all of that yet. And so to come and share that information while they're still in it it's just not appropriate. It's too much. The other thing that this might bleed into is that if a subject matter is really emotionally charged, probably not a good thing to be talking about with clients and patients in the clinic space. I talk about this more, or I think about this more in the space of emotional regulation. Crying with clients is very delicate, and when we're talking about this aspect of being present for a moment of humanity, being emotional with a client is appropriate, potentially, if it's showing up in a space where that person who the provider is sitting with is really going through something that is significant. And we all have moments where we are very raw and heartbroken and our spirits might be broken and this sort of thing. And so in that context, it's appropriate to be moved by that. It's appropriate to be brought to tears periodically by the profoundly difficult experiences that folks might be having. However, we also, as providers, have to be aware of where that line is that I need to keep it buttoned up and not fall apart because I won't be able to put it back together. In the clinic space, the person who's in the provider role needs to be in control. They need to be able to navigate that time and space and interaction. And so if they're coming to a place where they are dysregulated, this is a problem. I had a teacher when I was working on my master's who said to me, I don't care how you feel when you wake up in the morning, you have a job to do and you need to show up to do it. And there are nuances to this. There are also generational gripes about whether or not this is the best way to approach professional work. But in healing professions and having a job where I do feel obligated to my patients, I do feel like if I don't show up to my best capacity and able to do that job, I'm potentially causing harm, and that's not okay. And so there's nuance to this, obviously, more than that. But at the end of the day, providers are in the room to provide treatment and help and support. That you're not there for your patients and clients to support you. So if a provider shows up and they're like bawling and emotionally dysregulated, they just can't do the job, and that is not okay. It's ethically not okay. Just it breaks the relationship is a problem. So that's important to kind of be aware of. And I think when that gets to an extreme, most folks can pick that out and be like, yeah, no. But it bears sort of articulating. And the third thing, there may be more, but for our conversation, the third reason to not disclose, which I touched on a little bit earlier, but to say it more explicitly, is being seen negatively or as someone who is an incompetent provider. So in some cases, and this depends on the relationship, it depends on who the patient is, but depending on what is shared, it can kind of make the provider look like they can't do the job. And so that's not great. So you want to avoid any sort of disclosure that would potentially do that. Sometimes you can't know until you've made that mistake. And it's like, oh, whoops, shouldn't have said that. So all that said, we all have to decide and discern what's appropriate or inappropriate in terms of disclosure or lack of disclosure. And so I'm going to read this quote from that article that I mentioned, which is called, what is it called? Should psychiatrists self-disclose? And so the author says this, to wrap it all up: optimal rules of thumb are as follows. If a psychiatrist believes that a self-disclosure most likely will further the patient's good, it probably will. And a psychiatrist should self-disclose only information about which he or she feels comfortable. And so we talked about both of those things, not so much about furthering the patient's good, which of course we want to, that's like, obviously. He goes on to say, on the contrary, if the psychiatrist fears at all that he or she could be sharing part of his or her, in part for his or her own benefit or to quote unquote vent, they probably shouldn't. And likewise, if the psychiatrist feels at all nervous about self-disclosing, they probably shouldn't. So I really like that. I think that's a really lovely synopsis of deciding whether or not it's appropriate to self-disclose. Anything we do in the space of clinic and healthcare should be to the benefit of our patients. Point blank, end of story. That's it. And it gets complicated. It can be difficult to tell what will or won't be beneficial. And sometimes you don't know till you've said something, and then you're like, oh no, you see somebody react. And that's when that modeling of straightforward communication, hey, I just said this and I notice your expression changed a little bit. Tell me what that's about. So that can also show up in that space. And so, of course, we want to be aware as we can and as intentional as we can be. And also, there's no better teacher than experience. And so practicing, and I wouldn't necessarily say this is a good place to experiment, but it's a good place to be thoughtful and very intentional about what you opt to share or not share. This is a very specific context of interaction, of course, but I do think it also applies, as a professional, in terms of social media sharing, what is or isn't appropriate to share on social media. When I was a kid, my mom said, don't write anything down you wouldn't want splashed across the headline of a newspaper. So, right, it's very quick and easy to happen in this day and age where like all of a sudden somebody just kind of goes viral or whatever, and then it is splashed across the headline of any number of media outlets and that sort of thing. So, but personally, overall, when I do opt to self-disclose, it's usually in the service of diffusing shame. That's something that I think a lot of folks suffer needlessly from. And so if I can share something from my experience to help kind of normalize and diffuse that and show folks that there is hope, there is another side, like it is possible to get through that, I think it's well worth it. The other thing that I'll say that I've been thinking about the whole time preparing and recording this, which I feel like shouldn't need to be said, but nevertheless, is to not lie, right? I think it's a human impulse to want to help somebody. And so in some cases, when we're talking about self-disclosure, it's like, oh, I'll just tell a little white lie about like, oh yeah, I had that too. Why? Like, it's not worth it. So, of course, there's that. Again, I don't think that needs to be said, but just in case like that, I would never recommend anyone lie. And I think it is reasonable, like I said earlier, if you're unsure, to just err on the side of not saying anything if there's any question about it. So at any rate, that's what I have for today's video. These are my thoughts as it stands now. Like I said up top, they may change at some point. Likely they will, of course, because experience should change our opinion and how we approach things. So I'm sure at some point I'll look back and be like, oh, actually I would change this or that or add something else to this conversation. But if you're a provider, I'd love to hear, have you disclosed and found it helpful for your patients or clients? If you have seen a mental health professional, have they disclosed to you? And how was that? And then is there something else that you would add to the conversation about disclosure, something that I missed, a nuance that I didn't talk about here? I'd love to hear what your thoughts are as well. So leave them in the comments below. Of course, if you have made it this far, thank you so much. I super appreciate it. And I would love if you would like this video, subscribe to the channel and the podcast if you find it helpful. My dog just barked. And at any rate, I will look forward to seeing you next time.